Hello, hi, welcome to my channel. This is Dr. Erica. Thank you for joining me again. For today's topic, I'm going to give some tidbits on diabetic lifestyle changes, how to best control diabetes or hyperglycemia, how to utilize devices, and how best to utilize medications as indicated for best outcomes and to suppress adverse reactions, adverse effects that we don't particularly care for. So we want to make sure that we are, as healthcare providers, giving out that information. So I am going to talk today about Ozempic or semiglutide. It's very popular because it is very prevalent in weight loss therapy among female populations, and it has been broadcast that this medication is being purchased and being used for that reason and that reason alone. It is actually indicated for the reduction of hyperglycemia, the betterment of the A1C, or the 3-month evaluation of glycemic control, also to help patients live a better outcome and a better life with diabetes. And we know that diabetes is reversible with diet and exercise. So we do want to make sure that uh, patients are aware that this medication, semaglutide or Ozempic, should be only used for its primary indication, which is the lowering of glucose and not for weight loss. The manufacturer has released a statement that says we do not encourage the use of this medication for any other than for glycemic control. So those who choose to use the medication off-label, the manufacturer has given its warning and has asked that this medication be discontinued for other reasons than its primary um, reason for being distributed. So I'll leave that to the public to digest and to make amendments to their use of Ozempic. Okay, any medication that is used off-label, any medication that is used besides what it's indicated for can be detrimental or life-threatening, and so pharmaceutical companies do want to make a note of that. So that is the first tidbit that I want to give. The second tidbit is that those patients who monitor their blood glucose on a daily basis, regular basis, usually after mealtime, should use proper cleaning, should test their blood sugar with sterilization, and also be consistent with their actual monitoring to make sure that the control is actually being controlled as appropriately. Okay. Also, we want to encourage patients not to share their devices, not to share or offer device usage, any particular part, whether it be lancets, the actual monitoring device itself, test strips, all of those things can be cross-contaminated, and so we want to avoid all sharing of those products. Thirdly, it's recommended that patients are consistent and adherent with glucose medications. If there's an issue, a side effect that is hindering a patient from taking their medication as prescribed, please let your healthcare provider know about this so they can make adjustments properly to the medication regimen. Side effects can usually be GI upset, like indigestion, diarrhea, can be also uh, side effects such that can affect the heart rate, also side effects that can adversely affect mood, things like that. Also can affect use of other medications. So do be aware of that possible interaction. Now, most medications such as insulins and other anti-diabetic injectables should be kept refrigerated. If not refrigerated, they can be kept at room temperature for a short period of time as long as they have not been actually opened. So if they have not been opened, they can be refrigerated. If they have been opened, then they can be kept at room temperature for a short period of time. So do be aware of that, depending on the type of insulin that you may be using. And the manufacturer's pamphlet, the manufacturer's manual that comes with the prescription will give you that particular information. Also, let's make sure that medications are not only stored properly, but are utilized properly with meals or with water. And we are taking them as prescribed. And besides monitoring on a regular basis, do make sure that we're not sharing our devices and so forth. Okay, the fourth tidbit that I want to give is dieting. Dieting helps reduce glucose, and also calorie counting helps to reduce glucose levels. So do be aware of that. If a patient is going to eat a meal, they should do calorie counting. If they're not on a calorie counting nutrition recommended schedule, then they can also do a decrease in their carbohydrates, their fats intake, and their sugar intakes. They can substitute sugars. They can substitute sugars for honey, for sodium, for sodium products, for non-sodium items. Also, they can substitute sugars and dressings for vinegars and for apple cider vinegar, things like that, to help substitute and reduce the amount of sugar and carbohydrate intake. Also, there is recommendations that patients should increase the amount of protein, increase the amount of green vegetables, and also fruity berries as well. Fruits, vegetables, fiber, protein, all of that can help bring down glucose to a tolerable level and also help manage the amount of medications that have to be taken. Okay. Now, the fifth recommendation or tidbit that I have is to make sure that we are exercising. 30 minutes, 5 times a week can help reduce a patient's diabetes and also help increase muscle mass, lean mass, help reduce fats and carbohydrate sugar levels, and also give a patient an overall healthy outcome with diabetes. So do be aware of that. Again, that is exercising, moderate intense exercising. That can be 30 minutes, 5 days a week with either weights or non-weights. That can be walking, swimming, yard work. It can also be patients who are jogging or stair walking, taking the stairs instead of taking the elevator, or taking a long walk, brisk walk, instead of just, or jog instead of a walk. Those are alternatives to help patients lose weight and come off of diabetic medications. Diabetes, there's no cure currently, but it is reversible and helps to reduce the macro side effects, which is like the kidney disease, also blindness. It can also be changes in kidneys, eyes, foot care as well, ulcers of the foot. We want to reduce all of those risks by reversing and getting our glucose levels back to normal without the use of medications. Pre-diabetes is better than diabetes. Non-diabetes is better than pre-diabetes. So if you're pre-diabetic or you're on the verge of diabetes, this is the opportunity to get health in check, get the circumference of our waist down, get our body mass index to a tolerable level, get our glucose in control so that we don't have to continue along this path, needing medications, needing glucose testing, needing devices, checking in with the pharmacists and the doctors on a daily, weekly basis. We don't want that. We want to prevent, and that is going to be our diet and our exercise right away. Okay, so those are the 5 health tidbits that I want to mention on this particular video. Lifestyle changes. Again, that's going to be your diet, your exercise, your non-cross contamination of devices and sharing of devices. Also, use of medications like the semiglutide or the OZEMPIC as indicated and not for off-labeling purposes. And also to manage the side effects of medications, being adherent with medications. Those are the 5 lifestyle changes that I want to mention. Being adherent with medications will help control glucose, getting better outcome, reducing risk of hospitalization, reducing risk of cardiovascular events such as stroke, heart attack. I want to avoid all of that. Glucose plays a role in that. High cholesterol plays a role in that as well. High blood pressure as well plays, all those come together to play a part. And we don't want that. We want to reduce that. And so that's why I'm giving this video today. If you have any comments, please leave them down below. I'm Dr. Erica. Thank you for joining me. I hope this was very helpful. Have a good day. Bye-bye.